You mentioned genetics, and genetics is something you really need to do once in your lifetime. Your genetics really doesn't change. We're certainly learning more about nutrigenomics and epigenetics and genetics, and that's a whole other conversation. But from what everybody says, I don't agree actually, but from what everybody says, your genetics really doesn't change from the time you're born until the time you pass. I disagree with that, just for the record. But generally speaking, you got to check that once. So there's definitely a priority list that we could put together of things that you could be looking at. And then from there, you can dive in. Like as you check your hormones and your cortisol levels, you can then look to see maybe how the thyroid is operating and T3 and T4 and how that's producing. And you can look at your red blood cell count, your white blood cell count, and you can look at your hormone levels for testosterone or progesterone, or right. Like we can start to dive into the broadest spectrum, which in my opinion is blood work. You can then do nutrient testing and figure out where the holes and gaps are in your food and how you need to supplement. The reality is there are some really basic tests that you can do relatively easy. There's a Quest diagnostic all in every city here in America where you can go get a blood draw. It becomes very easy for us to get access to a wealth of information that can then point us in the right direction of where we need to focus our attention, what lever we want to change. Because look, I can add magnesium if I have a magnesium deficiency. I can do the B vitamins if I could look at methylation if I wanted to look at say MTHFR, which a number of folks out there are talking about right now, and these different ways that we methylate different vitamins, minerals, and nutrients, the way that we absorb these different nutrients. So there's a wealth of knowledge that's available to us for less than $1,000, let's say every 6 months. You can go and get a pretty comprehensive blood draw that will tell you a good amount about your overall health and wellness. And in my opinion, that's probably one of the first places to start. Steps are great. Calories, tracking calories is a pain in the ass. But again, if you're working on your weight, calories in, calories out is a thing. Hopping on a scale once a day is a thing, even though water weight will fluctuate from morning to night. On if you're taking your weight every day at 7 a.m., that's going to be consistent with your waking weight or your evening weight. And you just need to compare it apples to apples.